Public healthcare users in the Northwest say long waiting times and an ongoing shortage of medicine is negatively affecting their lives. The fourth edition of the annual Northwest State of Health report by Ritshidze corroborates these, also highlighting a dire shortage of medical personnel. Refiloe Seboko reports.
Residents have voiced their frustrations with healthcare facilities in the Northwest.
Ke tsama clinic ku unit 9 ha ke a go phaka medical waka o ke o nwang ke dula sebaka la ke apere di overall ke re ke ya mmerekong ha ba khone gore thusa ka nako so ke nana ngwana wa disability ha ke ya clinicing tlamele ke batle di pampers ba ntia nako ngwe ha ke di kry nako ngwe ke a di kry mare ba mpha packet e one ha ke gane wa gola mare ke a mo direkela.
One resident who didn't want to be identified says he stopped taking his chronic medication due to inconsistent supply.
Nna ke nwa medication wa epilepsy le high blood. Le gona nong ga ke khone go bona ebile ke tswile le modion tseo ke sa tlhola ke o batla because ke tswa go Bophilong the provincial hospital ka ba mpolelela ke nagana gore bana le faila me ke tlhotse motshegare otlhe ko I'm unemployed ile le ka dinao ko distance eo ha ke hetsa ba nthaba re ke ka dipakete tsa medication ke ipotsa gore mo filing a ga go akwadiwa gore prescription ya me ke efeng.
The Dr. Kenneth Kaunda district is still lagging behind in its ARV program to give 3-month supply to eligible HIV patients. Staffing shortages also still persist. Recommendations have once again been made to the Northwest Health Department.
For instance, in instances like around staffing, where we've asked the department to fill all vacancies and establish new positions, since 2021 that hasn't been done or implemented, or even hiring the sufficient numbers of healthcare workers. In some instances, that has not been implemented as yet. They should ensure that all eligible people living with HIV get a 3-month supply of their ARVs, and this is also required in the National ART guidelines. We also ask that the Northwest Department of Health better support the stock management to ensure that there are enough ARVs at the clinics.
The Provincial AIDS Council is calling on officials to act with caution.
We must be very careful not to just give people ARVs all over. A person coming to Lonely Park Clinic, go to Rustenburg, go to there, because ARVs have been found to be used on Nyaupe. So part of the things that we must manage is to make sure that we are giving the ARV to the right person at the right time, and we are not in a stage found at any stage to have contributed to ARVs being sold and being used in Nyaupe.
The Northwest Health Department says it's still verifying some of the contents of the Ritshidze report. For Newzroom Afrika on Channel 405, I'm Refiloe Seboko in the Northwest.